It was incredible how, when we started working with you, how that changed completely. Staff that work with WRS are just fabulous. They are totally responsive. They are on top of things. And the other thing that you provide is good training when we need it. Overall, we couldn't be happier with your system and your staff.
Thanks for your great service and support, is what I would say.
I am thrilled to introduce Kent Beduhn and Carol from Creative Change Therapy. Your practice has been leveraging WRS Health Psychiatry Cloud for 9 years. We are eager to learn how our solutions have supported your practice's growth. So, Kent and Carol, before partnering with WRS Health Psychiatry Cloud billing services, your practice faced inefficiencies in managing patient account receivable, which affected your cash flow and created difficulties in handling patient payments. Could you share more about these challenges and how they impacted your day to day operations?
Well, before we used WRS, we had a lot of problems trying to get consistent billing responses from insurance companies. And it was incredible how, when we started working with you, how that changed completely. So we were really happy about that.
It's one thing to work within the panels and to try to get enlisted in the panels. It's another whole level at which, working with the federal forms and working with the regular paper flow, that people that are trained and accustomed to working with that in a smooth and even keel way make a difference for a small practice like us. We're a simple mom and pop operation here, working out of a home office. And so we've tried to simplify our practice as much as possible and tried to simplify our business operations as much as possible. And WRS has helped us do that.
And the number of insurances that we've, accepted it hasn't mattered at all in terms of you being able to consistently respond to those. So that makes a huge difference.
Well, I'm happy to hear that, Kent and Carol. Now, I would like to ask, when you first considered using WRS Health Psychiatry Cloud billing services, were there any hesitations or concerns you had?
At least for me, I don't think so, because that we knew that that's exactly what we needed.
I think operationally, I wasn't always clear about how they're arriving at the balances due. Some of the bookkeeping seemed to be coming from places I didn't understand within the system. Since then, we've gotten extra training, and I think that's been helping a great deal us to keep on track with our own accounting and understand your accounting as well.
Perfect. Thank you so much for sharing that. Now let's move forward to the next question. How has WRS Health Psychiatry Cloud billing services streamlined your patient account receivable workflow and alleviate any hesitations that you had?
Well, there's been absolutely amazing responses and consistency in checking if we have the wrong insurance from a patient or any errors that, may be a problem. Those are immediately, we're let know, what has happened, and we can check with the patient to see if they have had their insurance changed. So it's been amazing the way you have kept up with us on things we may have, missed in our notes, or there's amazing cues in the system to handle that. So we are extremely pleased with the excellent responses we get from you all.
Yeah, I have a hard time separating it from the personalities of Monica Rosales and Kerwin Abiera, really excellent people who have been consistent and clear and excellent communicators, like Carol said. But also the regular follow-up and actually tracking people from month to month or even year to year, and recognizing, since the insurances are changing sometimes, and even the circumstances of who enters the practice and who leaves the practice are constantly shifting. We need people to track it on an ongoing basis. And so this is a moving target, and we need to be clear about what we can do to make a difference day to day, month to month, and they're helping us do that.
Well, that's fantastic to hear. Kent and Carol, since implementing these challenges, there was 110% increase in posting. How has this overall improvement impacted your practice's financial health, operational efficiency, and ability to focus on patient care?
That's largely due to some of the efficiencies that they've worked into the system in terms of recapturing monies that were lost. We've done a great job on return funds that we were missing, recapturing things that were not collected, sometimes aided by their billing efforts and sometimes by our initiative clinically, to work with the patients. It's usually their queuing that helps us realize how far behind it is. In the clinical realm, we don't want that we don't want the money to interfere with actually what's happening clinically as much as possible. Keeping that clean and separate is something that their work has made more possible.
And the other thing we really appreciate is the monthly reports that we get, discussion during those reports, what areas we need to, work on better and improve. So those really make a difference because it gives us an overall view of where we need to tighten up.
Perfect. Well, thank you so much for sharing that, Kent and Carol. May I know if there are anything else that you would like to tell us?
Well, one thing I would like to say is the staff that work with WRS are just fabulous. They are totally responsive. They are on top of things. They let us know when problems exist. And we have been, every single one that we've worked with have been really great.
Yeah, I'll underscore that. And I'll also say that the consistency is the other thing I really appreciate. The regularity and consistency of follow through. That's been a huge motivator for me, I think for Carol too, and it keeps us with our eye on the patients, and it keeps it kind of a clean board, so to speak, to write new work on and to actually help a creative process to emerge with the patients, to keep our eye on the ball, so to speak, and not to be distracted by too much business.
And the other thing that you provide is good training when we need it, which we really appreciate and which we recently used, which was very helpful. So overall, we couldn't be happier with your system and your staff.
Thanks for your great service and support. That's what I would say.
I'm really happy that you are happy with the services we are providing as your partner in practice management as well. It's wonderful to see how the training and the billing services have transformed your patient AR process and improved the cash flow. Of course, your feedback is invaluable, and we truly appreciate your partnership.